new ideas, approaches, and perspectives like Assembly Bill 186. We as a cohort come here today to discuss this truly innovative bill. We hope to bring a level of awareness, competency, and insight into how we believe this bill can bring about change in an individual's well-being and in our communities. Now, before we begin, I want you to picture in your mind someone who uses drugs. What does this look like to you? Do you think they are safe? Do you picture them having HIV? Do you picture them using near your child's school? Do you picture their dirty needles being left behind on the streets? Do you picture them overdosing without anyone noticing until it's too late? Now, I want you to picture this person with access to clean needles, a safe facility, and a professional medical team. Do you want to see cleaner communities? Do you want to see less needles on our streets? Do you want to help our clients facing addiction? If yes, we must embrace innovation and must embrace safe injection sites. This is what AB 186 represents.
So we are in the middle of an immense drug opioid epidemic. Allow me to share 7 statistics with you. Number 1, more than 500,000 people have died in the US from drug overdoses between the years of 2000 and 2015. We are in an epidemic that is so widespread that 35% of children that were surveyed, by the time they were age 15, they had already tried drugs. Number 2, in 2011, drug overdose overtook car accidents as the #1 accidental death. Number 3, drug overdose is the leading cause of death for Americans under 50 years old. Number 4, over the past 5 years, the opioid crisis has contributed to the tripling of new hepatitis C cases. Number 5, syringe access programs do lower healthcare costs. The estimated lifetime cost of treating a person who is HIV positive is between $385,200 and $618,900. Number 6, hospitals in California treat an overdose every 45 minutes. And number 7, someone dies of an overdose every 90 minutes in California. So something has to be done. And AB 186 was introduced by Assemblymember Eggman, and her bill provides the opportunity to specific cities in California within the counties of Alameda, Humboldt, Los Angeles, Mendocino, San Francisco, and San Joaquin to develop and operate public health and safer drug consumption programs.
So AB 186, what does it mean exactly? What does it do exactly? Well, it allows local governments within the 6 counties to establish the opportunity to establish a supervised consumption service pilot program until the year 2022. The program will have to meet certain criteria laid out by the bill and collect data. AB 186 provides sterile healthcare facilities supervised by medical professionals. They provide the access to sterile drug consumption equipment, in other words, clean needles, and proper use of disposal for those used needles. It provides access to and referrals for drug treatment, medication-assisted treatment, medical care, social services, and more. It provides the life-saving overdose reversal drug naloxone, and the benefits of AB 186 are to increase referrals to and engagement in treatment, eliminate overdose deaths on site, and reduce them in the surrounding areas. It saves millions of dollars in healthcare costs, and criminal justice. It will reduce syringe litter, public injections. And what does AB 186 not do? It does not increase crime or drug use in the area. It does not increase the number of people who use drugs. It does not increase relapse rates, and it does not increase violence.
Safe injection sites are already being implemented around the world and have shown to be working. There are more than 90 sites that are implemented and have shown to be consistently yielding safer and positive results, such as reducing the contraction of HIV and hepatitis. They have also shown to minimize crime, increase the addiction to recovery, and have brought jobs within the helping professions. Most importantly, they have connected addicts to resources, which has significantly reduced the amount of deaths from overdose. Despite millions of injections that have occurred at more than 90 facilities internationally over the past 3 decades, not a single overdose death has been recorded. Treatment has proved to be effective, as a present study demonstrates that the opening of a safe injection facility in Vancouver produced a greater than 30% increase in the rate of detoxification services among addicts, in comparison to the previous year when there was no facility available. In 2007, 45% of addicts in Germany have achieved total recovery and abstinence following the implementation of this program, and in Switzerland, 43% achieved recovery.
This is an issue of human rights. To reference the Universal Declaration of Human Rights, Articles 3 and 5, everyone has the right to life, liberty, and security of person. Are people suffering with addiction granted security in dealing with their disease? Are their children, spouses, parents, and families? No one shall be subjected to torture or to cruel, inhuman, or degrading treatment or punishment. When we dismiss, judge, harass, or neglect people living with disease, and then punish most often the poorest and most marginalized by barring and stigmatizing them from society, we are blatantly acting inhuman. Consider the notion that we are unwarranted and undeserving of our privileges. We have done nothing to merit the upper hand they give us in the world. We just walk through life with certain advancements, completely irrespective of our own choice. If this is true, one must also agree that we are equally as undeserving as our misfortunes. Genetics, diseases, the areas we were born into, the trauma inflicted on us at the hands of others. All of these afflictions lend themselves to a response from the survivors as a manner of coping. And if you just happen to be gifted with an addictive biology, trauma, low SES, a lack of emotional support, or physical or mental ailments, you are at risk for becoming an addict.
The social work perspective acknowledges that drug overdose affects families. More than 8 million children live with at least one drug-addicted parent. Those involved with the helping professions understand that this affects the family system in the following ways. Between 1/3 and 2/3 of all child maltreatment cases involve some level of alcohol abuse or drug addiction. Children with parents who abuse substances are 3 times more likely to be abused and 4 times more likely to be neglected than those who grow up without an addicted parent. Children of addicts are also more likely to live in foster care or with non-parent caregivers. Combine this information with the fact that 57% of drug users state that they currently use drugs in their home, the home of friends, for fear of being arrested or harmed. And it is easy to see that an alternative use site is necessary for the person addicted, their family, and the system.
Innovative ideas, such as safe injection sites, are imperative towards helping our clients heal and rehabilitate. We, as social workers, should embrace this new concept to have cleaner communities, stronger families, and to uphold human rights. If we are ready to be part of change, if we are ready to embrace new ideas, if we are ready to bring innovation into social work, we can make a difference. We must remember that our clients are more likely to access treatment if they are alive. We cannot treat the dead. Let's embrace change together and make a difference, because all lives matter. AB186 has 19 votes in the state Senate and needs 2 more to pass by September of 2018. It is possible to make changes. It is possible to make California a safer place to live, less dirty needles on the street, less overdoses, and less broken families. Innovation is not easily embraced. New ideas take time and deliberation before they can be immediately achieved. Our cohort initially struggled with this concept of safe injection sites, but we stand before you today united as a team. We recognize that the idea of safe injection sites are far-fetched and impossible to achieve, but we ask you to give innovation a chance. We encourage you to continue this conversation, no matter your specialization, because drugs do not see color, age, gender, or race. It can be any one of our clients, and it can be any one of us. We can all become leaders of innovation. We can all be part of change. So let us help our clients in new, meaningful ways. Please stop by our booth during lunchtime if you have any questions about safe injection sites or AB186. And we would also like to thank Marley and Trey for helping write the speeches for today. Thank you.